The most common symptoms of monkeypox includes a rash, which starts on the face and spreads to the body. Cases of monkeypox, a rare, little known disease, are being investigated in European countries, including the United Kingdom, the United States, Canada, and Australia. On Friday, the United Kingdom confirmed the number of cases had more than doubled, bringing the total to 20. Health Secretary of the United Kingdom said 11 new cases had been confirmed and most cases were mild. The UK government has brought stocks of smallpox vaccine to guard against monkeypox. Now, the big question, how common is monkeypox? Monkeypox is caused by the monkeypox virus, a member of the same family of virus as smallpox. Although it is much less severe, and experts say chances of infection are low. It occurs mostly in remote parts of the Central and Western African countries near tropical rainforests. More people in more places trust that there are two main strains of virus, West African and the Central African. Two of the infected patients in the United Kingdom traveled from Nigeria. So it is likely that they are suffering from the West African strain, which is generally mild. Another case where was a healthcare worker who picked up the virus from one of the patients. More recent cases, do you have any known links which each other or any history of travel? It appears they caught it in the United Kingdom from spread in the community. The UK Health Security Agency says anyone with concerns that they could be infected should see a health professional but make contact with the clinic or surgery ahead of a visit. What are the symptoms? Initially, symptoms could include fever, headache, swelling, back pain, ache of muscles. Once the fever breaks, a rash can develop, often bringing on the face, then spreading to the other parts of the body, most commonly the palm of the hands and soles of the foot. The rash, which can be extremely itchy or painful, changes and goes through different stages before finally forming a scab, which later falls off. The lesions can cause scarring. The infection usually clears up on its own and lasts between 14 to 21 days. How do you catch it? Monkeypox can spread when someone is in close contact with an infected person. The virus can enter the body through broken skin, the respiratory tract, or through the eyes, nose, or mouth. It has not previously been described as a sexually transmitted infection, but it can be passed on by direct contact during sex. It can also be spread by contact with infected animals such as monkey, rats, and squirrels, or by virus contaminated objects such as bedding and clothing. How dangerous is it? Most causes of the virus are mild, sometimes resembling chickenpox, and clear up on their own within a few weeks. Monkeypox can sometimes be more severe, however, and has been reported to have caused deaths in West Africa. Are gay men at higher risk? Although some of the cases have been seen in gay and bisexual men, anyone who comes in contact with somebody who has monkeypox could potentially get the virus. The United Kingdom Health Security Agency has said a notable protection of the recent cases in the UK and Europe have been found in gay and bisexual men. So we are particularly encouraging them to be alert to the symptoms and help if concerned. How common are outbreaks? The virus was first identified in a captive monkey, and since 1970s there have been sporadic outbreak reported across 10 African countries. In 2003 there was an outbreak in the United States, the first time it had been since outside Africa. Patients caught the disease from close contact with pariahs, dogs that had been infected by small mammals imported into the country. A total of 81 cases were reported, but none resulted in death. In 2017, Nigeria experienced the largest known outbreak. There were 172 suspected cases, and 75% of the victims were men between 21 and 40 years old. And what's the treatment for this? Outbreaks can be controlled by infection prevention. Vaccination against smallpox have been proven to be 85% effective in preventing monkeypox. The United Kingdom has brought doses of smallpox vaccine, but it is not clear how many jabs might be given. Should the public be concerned? Expert says we are not on the brink of the national outbreak, and according to the Health Security Agency, there is low risk.